Welcome. This is a webinar on getting to know Medicare. There's a lot of aspects to Medicare that we'll be going over today. It's a little bit confusing. With any questions you have, please reach out and call me. My phone number is 603-491-4092. Now I'm going to share my screen. Hopefully all works well with that. And I believe I'm sharing my screen. So the different aspects we're going to be covering today. What is Medicare? Who can get Medicare? What does Medicare cover? How much does Medicare cost? Where can I get more coverage? How do you choose? When to enroll? When I can change my coverage? And how can I save money? And where can I go for help? You can always come to me for help. I'm here to answer any of your questions like I went over before. But let's go talk about what Medicare is. Okay, so Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by taxes you pay in while you're working or your spouse was working. It's individual health insurance. Medicare is not a family health plan. It's not Social Security. It's not Medicaid, and it's not free. Now, who can get Medicare? All U.S. citizens and legal residents 65 years or older, or anyone diagnosed with end-of-stage renal disease or ALS. What does it cover? The original Medicare, now we're not talking about supplements here or Medicare Advantage, the original Medicare, it's Part A and B. So Part A is hospital insurance and Part B is medical. So Medicare Part A covers hospital stays, inpatient care. It includes your room, special care units, drugs and medicines while you're there, your lab tests, x-rays, skilled nursing service. It even covers rehab services after the qualified inpatient stay. So Medicare A, or hospital insurance, here's some fast facts. The premiums are free if you or your spouse worked for 10 years or longer. Now that could include also if you were a green card holder that married a U.S. citizen, or your spouse who's a green card holder worked. You can't be denied coverage. And covered costs there's a benefit period. It follows the calendar year, doctor insurance, but it's doctor and outpatient care. It includes, obviously, doctor visits, including when you're in the hospital, annual wellness care, clinical labs, x-rays, all your tests there. Some healthcare programs like smoking cessation, obesity counseling, physical therapy, occupational therapy, diabetes screening, mental health, ambulatory surgery, ambulance and emergency room service. This is a great program. It's one of the finest things the country has done. Medicare Part B insurance, here's some fast facts. There is a monthly premium adjusted for income. It can't be denied. You can't be denied coverage. It's national. This is the biggie. This premium penalty for late enrollment. Oof. So, you want to make sure you roll in time. Once in a while, people get surprised at how steep that is. What Medicare doesn't, it doesn't cover everything. Original Medicare A and B does not cover all the costs of your care. If you have outpatient costs with no limit, prescriptions, any medicine doesn't cover. Dental, vision, hearing, eyeglasses, long-term care, custodial care, excess charges by services like doctors. How much does Medicare cost? Medicare costs, now remember, this is just for A and B. So Medicare is a fixed amount that you pay for coverage a month. So there's a deductible, there's co-pays, there's co-insurance. It only covers 80/20. For a hospital stay, you can see kind of what it does. The premium costs you nothing. Deductible is $14.08. Other costs, you can see that you're pays is $352. Lifetime reserve days, 60. So Medicare cost examples. If Matthew here was admitted into a hospital in January and stayed 5 days, and he was readmitted in April and stayed 65 days, more than 60 days passed between his first and his readmittance. The deductible, Matthew's got to shell out $14.08. For the second stay, another $14.08. Days 61 to 65, Matthew ends up paying for 5 days at $352. So his stay would cost him $4,576. So the B is going to cost you this year, which is 2020, $44.60. Your deductible is $198. Other costs, 20% of approved amount for most covered services. Excess charges, if any. If it got charges, whatever the charges are, you have to pay the 20%. And note, there's no out-of-pocket limit. Here's some example Medicare costs. Ellen has heard about doctors accepting Medicare assignment, and that it has something to do with out-of-pocket costs. She asked what the difference in costs would be if the doctor accepted assignment or not. Accepted assignment is this in column and refuse. Usual customary doctor fees. Well, they both get paid the same. Medicare approved amount, reduced Medicare approved amount. Notice it's gone here, but it's here. Medicare pays 80%. Ellen pays 20. Ellen's share, if the doctor refuses assignment, then it's $73. So that's important to check out. Make sure your doctor is not refusing assignment. So where can I get more coverage? Two options. We're just going to briefly go over those. For more details, you'll want to reach out to me and we can dig down deeper. But option one, it's Medicare supplemental insurance. It's offered by private insurance companies. They help you pay the gap or what isn't paid by original A and B. There's also Medicare Part D for drug. It's the drug coverage. It's also offered by private insurance. So that's one option. The next option is you choose a Medicare Advantage plan. Now, the Advantage plans do have some advantages over them and some disadvantages. They call Medicare Advantage Part C, just to confuse you. No, I'm teasing. But it combines Part A and Part B. It's offered by private insurance companies. And it also, most of them include a drug plan. But they also offer additional benefits not provided by the original Medicare, like teeth, eyes, ears, those things. It's great. So Medicare Advantage Part C, another way to get your Medicare benefits. As I just stated, it's an alternative for Part A and B. The plan members are still in the Medicare program. Benefits are administered by the plan, which is a private insurance company. Medicare Advantage. So it has all the benefits of A, except hospice care, which is still covered by Part A. It's just a technicality. Don't get all upset about it. And all the benefits of B. Most Medicare Advantage cover prescription drug. And then they have added benefits such as dental, like I talked about, cleaning and x-rays, eye exams, eyeglasses and corrective lenses, hearing tests, hearing aids, and wellness programs if you're near a gym that participates. Medicare Advantage plans have an annual out-of-pocket maximum to protect against high costs. Medicare Advantage plans. Now, we're going to grind down into the details a little bit. I apologize, but we need to cover it. HMOs, Health Maintenance Organization plans. That's one, very common in most states. Preferred provider plans, PPOs, point of service plans, and special needs plans. Other types of plans include private fee for service plans and medical savings account plans. So fast facts. So you must enroll both in Medicare A and B and live in the plan service area. When you move from state to state, even if it's only a couple miles, plans change. You can't be denied coverage based on current financial or health status, including pre-existing conditions. This is great. May be required to use provider and family pharmacy networks. So they're going to have their pharmacies they prefer you to use. Most of them are common ones that you probably use now. Coverage and costs vary by plan and may change each year. It can change a little bit each year. It probably will. Annual limit out-of-pocket costs of service and may charge a monthly plan premium. Must continue to pay Part B. So you're always going to be paying that $144, and you may get charged an additional amount for the Advantage. So Medicare prescription drug coverage, or Part D, There's two ways to get coverage. You can get a standalone Part D, or you can choose an Advantage plan that has it built in. Now, they all vary a little bit from what I can see. They have their formula, the drugs they cover. Sometimes there's a little bit of moving around. You may pay a little more with X plan than Y. It's good to talk to a professional and dig into that. And most doctors and hospitals can give you help with that. Specific brand name drugs and generics are included in their formula. Vaccines are not covered by B, but are usually covered here. You got your first tier drugs and your second. And obviously it gets more. And you go to tier 5, which are specialty drugs, only Part D coverage. So you got your annual deductible up to the plan deductible. And then you have your initial coverage up to $4,020. And then a coverage gap or a donut hole of out-of-pocket expense. They do catastrophic. Obviously, you can see pretty easy that, you'll get great coverage up to about $4,000, a little bit of a break that you're going to have to pay for. These dollar limits will change probably most years, and the cycle starts January 1st. Your Plan D coverage, good to kind of check it out each year. Talk to your person and make sure. Medicare prescription drug coverage, fast facts, must be enrolled in A and B, may be required to use a pharmacy network, Coverage and costs vary by plan and may change each year, and the premium penalty if you don't enroll. Medicare supplement insurance. So we switched to the other one, the first one they showed us, where we talked about Medicare Advantage and Part D. This is a supplement, or Medigap, as some people would call it. You can't run this with Medicare Advantage. It's against the law to do that. It's a supplement of original A and B. 8 plans, 8 different plans, not companies, 8 different plans that are standardized by the government. What you're dealing with here is basically it's like a commodity. The government says you got to cover this. They can cover more, but they got to cover this. Massachusetts, and Wisconsin and Minnesota, different from standardized plans in other states. The way Medicare supplement insurance works is plans help you with the Part A and B deductibles. They pay for the co-pays, the co-insurance, and the excess charges. They pay for the cost for an extra 365 days of hospital care. Pay for blood. They pay for foreign travel. That's great. Plans do not help with, now this is just a supplement. They don't help with prescription drugs. Well, that's why you get a Part D. They don't help with dental, visions, or hearing care, eyeglasses, contacts. A lot of people will buy a dental and a visionary care on separate if that's a big deal to you. Or some dentists are self-insuring. They have like almost a program set up now there. It's nice. Extra days in skilled nursing facility after B, they don't cover. Custodial care, they don't cover. Long-term care. Okay, so here are the 8 plans. So not to be confused with Medicare A and B, this is the supplement plan. And I'm sorry they use the same letters because it makes it very difficult. So you can see these plans and you can see the big difference. That the Cadillac plan, if there is such a thing, is Plan F, but it's only available to beneficiaries who became eligible in 2019. So if you turn 65 this year, forget Plan F. The best you can get is Plan G. What's the difference, you ask? So right here, it's the deductible. So, wow, that's it. Really, Tom, that's it? Yeah. So that $198 we talked about. Now you can see most of the other plans don't cover it. Some do, but then they drop other charges. This is the Caddy plan if you're young. And honestly, if you wanted to see the difference in cost, some of these are not worth going to. If you're going to start messing around with some of these, you want to look at the numbers, the savings, if it's really worth it. Medicare Supplement Insurance, Medigap, Fast Facts, must enroll in A and B. No medical underwriting up to 6 months after enrolling in Part B. No underwriting when you first enroll. Nationwide coverage and no provider networks. Guaranteed renewable. Once you're on it, they can't throw you off even if you become really sick. Plan premiums vary for even the same coverage. I know they vary by states. It's very fascinating to me. Plans with more coverage generally have higher premiums. Continue to pay Part B. So you're always paying the 144, and then you're going to pay for this. What was the deductible? 198. So it covers a lot. Okay, does not cover drugs. So how do you choose? The original Medicare. So Medicare A and B, you could add D, you could just add a supplement, or they get their supplement in Part D, or they just go with an Advantage that has Part D included. Step one would be enroll in original Medicare, Part A and B, provided by the federal government. Two is you need to decide if you need additional coverage. There are two ways to get it. Option one, which is the supplement, and then Part D, or option two, Medicare Advantage. Considerations. If you went with the supplement, the coverage pays some costs not paid for by original Medicare. Does not help with drug coverage. Okay, what if you went Advantage? Provides the benefits of original Medicare and beyond, often includes drug coverage. May have a provider network, so you may have to stay within a group of doctors. Make sure your doctor's listed, have that checked for you. The costs, monthly premium, drug plan premium, so you'll have to get a drug plan if you're on a supplement, and there's out-of-pocket costs depending on the plan you choose. It's less if you go with G, obviously, but it's cost more. Medicare Advantage may charge plan premium. Often they don't. Offer no additional premium for drug coverage, but there's co-pays and co-insurance for most coverage services. Annual out-of-pocket maximum. Convenience. So there's multiple plans. When can I enroll? Okay, you turn 65, 3 months before, 3 months after. You got to enroll in Part A and B. Automatically happens if you're receiving Social Security or railroad retirement at age 65. You enroll yourself. If not already receiving, go to socialsecurity.gov or your local office. Most of the offices in Upper New England here are great. You can get right in. Call them. Enroll early to avoid gaps in coverage. You may refuse or delay enrollment in Part B. May enroll in Medicare Advantage or prescription drugs. Incidentally, I had a woman the other day. She thought she needed to enroll in Part B. She was working full-time and covered by her employer. It was a plan that met the minimum requirements, so she did not have to enroll. When she leaves her job, she's got that 3-month window either side. She can go 3 months early and apply, tell them the start date after. So you can do that. General enrollment period. For those who missed their initial enrollment period, may enroll in Part A and B or both. It's January, February, March, A and B, and you can get your other coverage, your Medicare Advantage and drugs in April, May, June. You can choose to enroll in them. You may have some penalties if you waited too long. Medicare Supplement, open enrollment. You turn 65, you have 6 months. That means month 7 is you're entering the penalty area. So there's no medical enrollment. May enroll in a plan later, but could be denied or charged more based on health issues, except in Massachusetts. We're not going to dig too much into that, but just so you know, call me with those questions. So special enrollment period working past 65, like I told you that woman did. So month after last month of employment or employees' health coverage. So maybe your company stopped offering medical insurance. There you go. So you got 8 months, 2 months to enroll in C and D. So you just get it done. Get it done early. Late enrollment premium penalties. Medicare A, none if qualified for premium free. Part B, none if qualified for SEP, otherwise 10% for each full 12-month period. You wait 2 years, that's a 20% jump on the 144. Part D, none if less than 63 days without credible coverage. That's covered by you, your employer, if it's qualified, or yourself. Some of these really chintzy, cheap plans that are out there are not considered qualified, and thus you will pay the penalty. Otherwise, it's 1% of the current average premium for each month. That's 12% a year. When can I change my coverage? Medicare annual enrollment starts October 15th, goes to December 7th. You can't enroll before that. You can switch from original Medicare to Medicare Advantage, or vice versa. You can switch from one Medicare Advantage plan to another. You can join, switch, or drop Medicare prescription drug plans. Big note here is don't stop, if you're switching from one plan to another, make sure you're enrolled before dropping the old one. Medicare Advantage open enrollment is January, February, March. Well, let's go back one, Tom. Let's see. Annual enrollment. Well, that's interesting. Now look at that. And this is open enrollment. It's available to Medicare Advantage plan members only. You can switch to a different Medicare Advantage plan or return to the original Medicare. Enrollment in Part D if returning to original. So it allows you to bounce around. You may pay more for your health when you can be denied. So make sure you're taken in. Special enrollment periods. If you move out of the plan service area, so you move from New Hampshire to Vermont, there you go. Massachusetts to New Hampshire, there you go. You leave, move within a plan service and have new plan options. So example is if you move from Hillsborough County in New Hampshire, Cheshire County in New Hampshire to Hillsborough, there's other plan options there. You can qualify for special needs plan. You move out, you move out of an institution. So maybe you were in a nursing home for rehab, and then you're going to move out. Get or lose financial help with Medicare. Move back to the U.S. after being outside of the country. How can I save money? Here we go. Use your benefits wisely. That just goes without saying. Use prevented services. Most everything we've gone over here, there are prevented services that are covered. That's about generic drugs, low-tier drugs. Use plans preferred or mail-in pharmacy. Sometimes the preferred pharmacy is less money. Just worked with a family, and for the husband, Rite Aid was better. For the wife, CVS was better, and they were both better than the mail-in. Anyway, there you go. It changes all the time. You can get financial assistance by calling your state SHIP office. You can visit Medicare. So you can get extra help with drug costs. You might be, if you're low income, you might be eligible to go on Medicaid. Anyway, there's also programs for all-inclusive care for the elderly. So where can I go for help? You can go to these sites. There's newsletters, Facebooks, all kinds of things. Or you can just call me and we can talk. We can run the variations of different plans and let you make an intelligent decision. Don't try to wing this. To be honest, I got to tell you, I signed up my wife for this a few years back, and I'm licensed for all this. Never sold it prior to then. And I spent 14 hours researching. And so I understand. There's a lot of bells and whistles. I'm very knowledgeable in this now. There we go here. Thank you very much. If you have any questions, call me up, Tom Villeneuve at Monadnock Retirement Solutions. You can go monadnockretirement.com. We'll get you here. You can rewatch this video as many times as you want and reach out to me. Tell your friends about this video. It's a great thing. Thank you very much.